Our next guests know about painkillers as well as the pain that Obamacare is inflicting on our healthcare system, doctors, patients, insurers, wreaking havoc on the medical profession, potentially creating a national shortage of some 90,000 doctors, 800,000 nurses by the end of this decade. Joining us now, Dr. Sreedhar Potarazu, CEO of Vital Spring Technologies. Doctor, good to have you with us. Dr. Mark Siegel, member of the Fox News Medical A-Team and professor of medicine at NYU Langone Medical Center. Gentlemen, good to have you here. Let me start, if I may, with you, Dr. Siegel. Where in the world are we going with this system? I don't even hear doctors discussed in this healthcare debate, and I wonder why not.
Well, you got to the first part of this, which is there's a big doctor shortage, and everybody understands that if you bring in more patients and you pay doctors less for seeing them, this is basic business sense, you're going to have a problem. So access to medical care is a huge issue. And on top of that, one of the things we're not speaking about as we focus on the state exchanges is the idea that there's 27 new regulations for Obamacare in 2014. That's going to mainly apply to the employer-based insurance, which insures 170 million people. What we're talking about with the state exchanges all the time, at maximum, would be 7 million. Now, the reason we're focused on the state exchanges...
Okay, you're throwing a lot of numbers.
Let me explain something.
Okay, but you're throwing a lot of numbers.
Okay.
170 million. What are you saying?
These are the people, like you and I, who get our insurance from our employer.
Right.
We're not going to the exchanges. We're already insured by our employer. Yeah. But we have all these regulations that are going to apply to what kind of insurance we can get.
Okay, that takes care of about 90 million people come through their corporate, typically corporate, health care plans. We got another 80 million to account for. Those are individual. Half of those, we're told, are going to be stripped from the ranks of the insured by the insurance companies themselves.
That's a great point. That's where I was going with this.
Okay, I'm sorry.
I was going with this. That, in fact, because of the regulations of Obamacare, a lot of the policies that people have through their employer are in jeopardy, and they may either end up on the state exchanges or uninsured.
Dr. Potarazu, let me ask you this. We're also learning in a report today that more people are signing up for Medicaid than even attempting to sign up for Obamacare. And we're talking about some numbers like in Washington, Kentucky. I mean, these numbers are like 60 to 80% of the new enrollments are for Medicaid, not for Obamacare. What is the impact?
Yeah, there's a lot to infer from that in terms of this trend, especially when you look at the risk pool of individuals that are signing up for insurance. And those states that saw this sudden surge in Medicaid enrollment were also the same states that signed up and set up their own state exchanges. But what's happening here is that you're getting a dichotomy, a split in the red states and the blue states in terms of the risk of the individuals. And what happens is that the red states that typically have more uninsured and sicker individuals are going to end up having more uninsured people who fall through the cracks. Yeah. And what's happening as a result...
There's another implication here, though, Doctor, and that is very straightforwardly, of the 2.7 million people are supposed to be young people, 18 to 35 years of age, are supposed to be signing up for Obamacare, who can if they want to
That was the strategy. That's right. That was the strategy. Because
it's a strategy, but the fact is they appear to be principal among those 18 to 35, they principal in signing up for Medicaid. We've got competing government programs. We're creating a perverse marketplace as a result.
Not to mention that half of the states didn't approve the Medicaid expansion. So that if you're in...
going to the red and blues...
right, that to his point. So that, right, exactly. So you could end up in a position where you can't afford the state exchanges if you could get to them, and you don't qualify for Medicaid because your state doesn't have it. It didn't expand. And by the way, Lou, I am not a huge fan of any of these entitlements. You know, when you're talking Medicaid, you're talking entitlement. When you're talking going to buy a bronze plan or a silver plan, you're talking subsidy.
Good Lord, you're not expanding our problem here, are you?
No, I'm just stating it. Our problem is that the entire program is based on subsidies. It's based on subsidies.
I'm with you. And the subsidies could overwhelm the entire thing. But we're caught here in a vortex of higher medical costs, higher insurance premiums, higher government debt, bigger government spending, and by the way, fewer doctors, fewer nurses, and a healthcare system that seems to be the last thing anybody is talking about.
Think of it this way. It's a cart that you're loading down with weight, and the horses that have to drive it are fewer and fewer. That's us, and they're coming up lame.
Well, I got the metaphor, but the fact is we got this thing called the Affordable Care Act. Dr. Potarazu, I want to understand. Is it your judgment that the problems go away if they can fix healthcare.gov, or do we see a steady worsening of the issue?
This is the tip of the iceberg, because I'll tell you as a doctor, and I'll tell you as an executive that's run 2 health IT companies and been in the industry for the last 20 years, that the issues with the website are only the tip of the iceberg, and it is symptomatic of much deeper problems around what we're going to call infrastructure. Right now, there's problems with consumers being able to get onto the website. There are problems in terms of determining eligibility, and there's problems in communicating.
Doctor, what about hospitals? What about care? I want to get to...
They're going to get crushed. They're going to get crushed, and here's why. Because the financing mechanics of where doctors are supposed to benefit and get rewarded is if those hospitals and doctors are able to communicate, and all of those systems are able to produce data to show that they're producing efficient care. Now, if they're going to work anything like healthcare.gov works, that data is never going to surface, which means that doctors and hospitals are at a disadvantage from day one.
You get the last word real quick.
Lou, he's talking about the larger part of the system, which is where I started today. Those who get employer-based insurance or have Medicaid have lower quality of insurance. They're going to go running to the hospital emergency room unnecessarily. The hospital's bottom line goes down, and they lose money. So both hospitals and doctors are in trouble under Obamacare, period. You cannot find a doctor in the U.S. that's happy about this who's in private practice.
One thing we can expect, if that is the case in results, that the Obama administration will bail them out. The problem, one of the great, large, looming problems is you can't bail out doctors who are not enrolled in medical school or trained nurses who are not available. Doctors, thank you both. We appreciate you very much.
Thank you.